So I'm going to talk about two studies that I have done that are related to media, both of which are in West Africa, where I have spent a lot of time doing research. But also, I will start by talking a bit about some of the context, some of the other studies, and what do we know about media, and what are some of the challenges to studying this, its impact rigorously. So, mass media is everywhere around us, from newspapers to social media. And so the challenge is, I think, how do you study what impact it is having? Because it is everywhere, and there's so much of it. You don't really see life without it. So how, as an economist, do you go around trying to study what impact it has? Another challenge in trying to study the impact of mass media on our lives is that people decide what mass media to be exposed to, right? So if this is just some basic descriptive statistics about the kinds of people who watch Fox News or MSNBC. And you can see that, people, unsurprisingly, people of different political affiliations watch different media. Now, is that because they watch Fox that they become more conservative or more likely to vote Republican? Or is it that people who are more conservative and more leaning towards Republicans are more likely to watch Fox News? That's a pretty hard thing to figure out. So what do we, if we care about rigorous evidence and analysis, what do we do to try and tease some of these things out? Well, one thing that you can do is go back in time, when there wasn't so much social media and there wasn't so much mass media around. And so that's one of the things that economists have done. So this is a paper about the impact of radios in support for the Nazi Party in Germany during their rise. And one of the things that you see is that, at the beginning of the period, you don't have that many political broadcasts on the radio. But over time, there's more and more use of the radio to get out political messages. The other thing that determined, and then also what changed over time, was those political messages changed in terms of what they were covering. So, maybe you can't see this in detail, but the white is the Weimar government's political messaging, and the black is the Nazi political messaging. So the amount of messaging goes up, but also the composition changes over that time. Well, again, if we just looked at the correlation between that and what people supported in Germany, we wouldn't be able to tell very much about whether it was the rise of the Nazi Party then led to more political coverage of Nazi themes, or was it that, them using the radio led to more people supporting them? So how do we figure that out? Well, what these authors do is they look at the strength of the radio signal in different parts of Germany. So you're not very likely to buy a radio, even if you can afford it, if you don't get much of a signal. And they argue that there's some randomness to where there was a stronger signal, and where, over time, sort of more infrastructure was put in to be able to listen to the radio better. And they see a correlation between the strength of the signal and whether people are buying radios and listening to the radio. And then what they show, which is quite nice, is that if you had the radio signal strength in the early period, when the Weimar government is in charge and putting messages out on the radio, owning a radio makes you less likely to support the Nazis. But later, when the radio is being used by the Nazi Party to get messaging out, owning a radio is you're more likely to support the Nazi Party if you have a radio. So I think that's a nice way of showing going back in time and using variation in whether people are exposed to a new technology, because not everyone had a radio at that point, to show how you can actually tease out the causal impact of mass media. So that's one strategy people have used. Another strategy people have used to look at the impact of media is geographic variation. So Indonesia is a very mountainous country. And if you're trying to get TV and radio signals out to the world, they will bump into mountains. And so what Ben Olkin did in this study was, if you look at the picture of the mountains and the radio mast on the right, he interviewed people who are in the shadow of a mountain and therefore couldn't get access to radio and television signals, and saw how their life was different from people who could be exposed to mass media. And what he finds is that people are much less, have much lower social capital in areas where they can get TV and radio signals. So particularly TV here, but they're highly correlated, so you can't really distinguish, but people are rich enough that if they get the signal, they can get televisions. And he finds, that you've heard of, presumably, of, bowling alone, and the fact that as a society we're having much less interaction, we're much less likely to be members of groups, like bowling groups that used to be very important in the US. And people had speculated that that was because we spend more time watching TV or being online. We're not going out and having these groups. Now, but again, how do you figure that out causally? Well, the way you do it is you find people who can't get television signals, and indeed you see that they're much more likely to be part of social groups. The third thing that, as you heard in the introduction, that I do a lot of randomized trials. So a third strategy that people have used is to try and randomize access to different kinds of media. So this is a paper where, again, they were looking at the impact of media on people's political opinions, and they randomized whether they sent you the Washington Post, which is a conservative newspaper, the Washington Post, which is a more liberal newspaper, and the Washington Times, which is a more conservative newspaper. And they looked at whether that changed your attitude. So, you decide what media you consume, but they just sent you a free copy. They, randomly picked some people and sent them a free copy every day for a number of months. I can't remember exactly how long they did this for, but and before a series of elections. Interestingly, what they found was whether you got the Washington Post or the Washington Times, you were more likely to vote Democratic as a result of being exposed. So that was kind of their argument, is you're more exposed to what's going on in politics, and any of that made you more likely to vote Democratic. So not necessarily exactly what you would expect to see. So most of the studies that we've looked at and most of the opportunities come about by manipulating people's access to one particular form of mass media. But we have to wonder, particularly in an environment like we're in now, where we're surrounded by so much mass media, that just changing one part, so just changing newspapers, that's not going to tell you the full effect of being exposed to mass media, because you're keeping all of the rest of it. You're still getting all the messages from all the other sources of media. So it's and the Washington Times, Washington Post study was done before you had anything like as much social media as you have now, it's very hard to kind of cut people off from all media. And so we're only getting a very partial effect by when we try and switch on and off like one source of information. So I'm interested in what happens when you go to communities that have very little exposure to media of any kind. And that allows you to think about, you know, the whole package, in a sense, of going from very little exposure to mass media to getting mass media might be very different than just manipulating a small part of what we see. So I'm going to talk about two studies that I did in Burkina Faso and Sierra Leone, which are both countries in West Africa, which are amongst the poorest countries in the world. You know, they're very different in some ways. Burkina Faso is quite dry. It's in French-speaking Africa. Sierra Leone is on the coast, you know, very lush, very green, and was actually set up as a result of it was founded in some ways coming from the people who fought slaves in the US, who fought with the British in order to get their freedom. Britain was like, what do we do with these people now? And some of them returned to essentially found Sierra Leone. So very different histories, very different places, but both very poor and in West Africa. And they're useful for attesting this because the level of information that people are exposed to is relatively low. So the first one is about Burkina Faso, and it's about family planning and the effect that being exposed to mass media has on you, on people's attitudes towards family planning. And again, West Africa is the place to go to look at this question because around the world fertility is declining very rapidly, but the high fertility countries in the world are mainly in sub-Saharan Africa, but the highest rates of fertility, a lot of them are now in West Africa. And I think it's just to pause on the implications for this for a moment. It used to be the case that most poor people lived in East Asia, right? Most people living under $2 a day lived in China. Then it was the case that most poor people living under $2 a day lived in India. Now, the country with the biggest, largest number of poor people is Nigeria, and 85% of people living in extreme poverty will be in sub-Saharan Africa. It's also the case that sub-Saharan Africa is where you have a lot of unmet need for family planning. What does that mean? That means people who are want to not have more children, but are not using contraception. They might be able to get a hold of contraception, but for whatever reason, they're not using it, but they report on the same survey that they don't want to have more kids, they're in relationships, but they're not using contraception. So we say that they have unmet need. They kind of want to use contraception, but they're not using it. Okay, so this suggests that there's there's a potential for helping them get access to information about the use of contraception. Now, I worked in Burkina Faso. I'm not French speaking, so I'm very reluctant to go to places where I don't know them very well or I don't speak the language. But Burkina Faso has this extraordinary and unusual media environment, which is most people are listening to, the most important media in the country is radio. That's true of pretty much every low-income country. But the radios are these small community radios. Very few people listen to the national radio because the national radio is in French, and pretty much nobody speaks French in rural Burkina Faso because very few people go to school. So nobody listens to the national radio. They all listen to the local radio, which is in their language. And there are many, many different languages in Burkina Faso, as is the case in many sub-Saharan African countries. So you've got these individual radio stations, which means that you can do something which, as a randomized trial person, is just extraordinary, which you can randomize by radio station. Right? This has only been done one other time before. So now what have they got in these? What do these radio stations do? They we took their plans, so what they cover at what times of day, and they do a lot of news shows. They fill the air, as in any, it's very cheap to fill the air with calling shows because you don't have to pay anyone, they just call in. So with like any low-cost media platform, calling shows are quite important. Music, and then there's some behavioral change programs on health and education, and then there's some religious shows. And we did an estimate, and we think that about 80% of the time, men are talking in those shows. Okay. So what do we do to try and figure out the impact of, we're going to look at two things. We're going to look at the impact of just having access to radio, and also to a media campaign on family planning that is presented through the radio. So we did a two-level randomized trial, which means we're going to randomize twice. So the first randomization we're going to do is randomly pick radio stations, and in some of them they're going to play this campaign run by DMI, a media campaign organization, on family planning. And it's going to try and provide information to people about family planning. So we've got 8 radio stations that broadcast the family planning program and 8 that don't. But not everyone in these communities has access to a radio. A lot of people are too poor to have a radio. So this gives us another chance to introduce random variation into whether people are exposed to mass media. So we interview women and find out which women don't have a radio in their household. And we randomly pick half of them to get a radio. And it's a wind-up radio, so they don't have to buy batteries. And we also tell them we'll give them an incentive if they're still holding the radio at the end of the program. And we give out radios both in the control area and in the treatment area, both in the campaign area and the non-campaign area. And by comparing women who did and didn't get the radio in control areas, we can look at the impact of mass media just having access to a radio. What does that do to your life? And these are places, there's no TV, there's no newspapers, there's no social media, like it's just, this is your kind of first mass media. And in other places where they've got the campaign, getting the radio means you get access to mass media, but you also get access to this campaign. We interview women, we collect data from the clinics, and we also have data on how many contraceptions, how much contraception is distributed in these different areas. So I'll tell you a little bit about the campaign. 2.5 years is a saturation campaign. You're going to hear about family planning a lot. And this is part of they're very much based on the evidence about what changes people's behavior. These guys, really look at the evidence before they design a campaign. 2.5 years, 10 radio spots a day. You're constantly hearing about it. And then there are longer term, longer form things where you can phone in and talk to a nurse who knows about family planning. It's informed by extensive formative research. Everyone who wrote for this show had to live in a poor community in Burkina Faso for a while before they started writing for the show. I mean, they're all Burkinabe. They're all from Burkina Faso, but they might come from the city, so they made them go live in these communities before they designed the shows. Okay, and there's a lot of stories and humor as a way to convey. So what did we find? Well, in non-campaign areas, so what's the impact of just being linked to mass media for the first time? And this is contrary to everything else in the literature up to this point. People reduce the amount of contraception they use. When you just get exposed to these radio stations, the control radio stations, people reduce the amount of contraception they use. But if you give people a radio in the areas where DMI is working, they increase the amount of contraception. So DMI campaign is not only overcoming whatever is making you less likely to use contraception when you get a radio. They're even increasing it above that. And then we can also compare all the women in the areas who got the campaign and all the women in the control areas. So that's our other level of randomization, right? We're comparing women in radio stations in treatment and control. And you see an increase in contraception use in the campaign areas, and that's particularly strong for people who had a radio at baseline. We can look at actual contraception given out, and you can compare before the introduction of the campaign and afterwards, and the treatment and control areas are moving pretty similarly before the campaign starts, but as soon as the campaign starts, the government's having to send more contraception to the areas of the country that are getting this radio campaign. And that's true of injectables, which is a very common way that contraception works in these countries. You inject something in the arm, and then it releases contraception, hormonal release. That means that you don't get pregnant over, multiple months. You can take this thing out, as soon as you want to get pregnant. Okay, so what did we learn about why this was working? So our best guess, so first of all, this is not a Fox News effect. It's not like the fact that in the control areas people stopped using contraception. It's not like these radio stations wanted to stop people using contraception. They were all keen to be part of the DMI experiment. But there were enough voices on these programs with people calling in that we think that they expressed kind of conservative views, the callers expressed conservative views, that it actually dissuaded people, women and their husbands, from letting their women use contraception. And remember, these are community radio stations, so they're mirroring back what the community believes. And the community is not, on average, is not using contraception. So if you simply get a mirror back of what the community believes, they're not mainly using contraception. But why did the campaign work? Well, we can see that the women were suspicious about contraception. There was a high number of women who thought that contraception was going to make them sterile. And the campaign persuaded them that that is not the case. So these are the women who didn't want to get pregnant, but they weren't using contraception, and they were worried that it was going to have nasty side effects. And the campaign persuaded them that that wasn't the case, and therefore they could go ahead and use contraception. And it also actually reduced the number of babies that were born. And if we look at the fact that those women didn't want to have babies, there's a kind of a 10% reduction in unwanted babies, which I would say is a pretty good thing, and an absolutely astounding increase in women's self-reported welfare. They just reported that they were better off. So whether or not they were using contraception, the ability to, knowing that it was there, seemed to make women happier. it was extraordinarily radio and mass media is an extraordinarily cost-effective way of change, if it does change people's minds, it's very cheap to do. So, an annual cost per additional woman using contraception of $47. If we just look at the program. Now, this program has now been scaled up to the whole of Burkina Faso. So if we project that on to the costs of what it costs to scale it up, then we think it's something like you get for every $8 you increase the number of people using, for $8 you have one more couple using contraception for a year. Okay, so that was a relatively straightforward. People don't know that contraception doesn't have negative side effects. We have a campaign, they learn that, they use contraception. A much tougher thing is to think about whether media can change how people vote in a context where there is a lot of ethnic voting, right? In some ways, we know that it can change how people vote. We see that with Fox News. There's been some work in the US showing that as Fox News rolled out, people became more conservative. But this is a particular issue that people worry about a lot. This is a picture of Sierra Leone, and it shows the ethnic composition of the country. So Mende in the south, so in green is the area, is the parts of the country where over 30% of the population, so I've colored in green any district that has more than 30% of the population is Mende. And then in red is any district where over 30% of the population are Temne, okay, which are the two biggest ethnic groups in Sierra Leone. And you will see that the voting completely matches where the Mende, like the SLPP, get all their votes from the south, and the APC get all their votes from the north. Now, there is this swing area in the northeast, which is the Kono area, where there's another ethnicity, and sometimes they vote with the SLPP, and sometimes they vote with the APC. So in this, you can see it's a little bit split I can't remember exactly which election we're using for this data. But what's interesting, though, is that ethnic division of voting holds very tightly at the national level. It does not hold in local elections. So people will split their ticket and they will vote for the party that represents their ethnicity for president and for MP, but they're much more likely to switch there to somebody else, if you're in the South, you vote SLPP for the president, but you might vote APC in your local election. So a colleague of mine, a co-author, I didn't work on this paper with her, but somebody I've worked with a lot, Kate Casey at Stanford, wrote a paper showing this fact that people will cross ethnic lines in the local election and asked, well, why is that? And her hypothesis was that it's because people don't know anything about their MP or the president. The only thing they know about them is their ethnicity, so why not vote based on their ethnicity? But in the local elections, they actually know these people. And so they have views about whether they like this person or that person and whether they think they're good or not. And so they're more willing to change who they vote for because they know something about it. So it's actually it's not that these ethnic divisions are deeply entrenched, as they are often portrayed in the Western media about Africa, but actually it's just, well, I ain't got anything else to go on, so I might as well go on ethnicity. Okay, so that was her hypothesis. One of the ways she used to test that was to look at where it was that people did that ticket splitting. And where you had local radios, just like the local radios that we learned about in Burkina Faso, there was much more of this crossing party lines, of voting for someone who wasn't your ethnic. It's not of your ethnicity. If you're in the South, the APC are going to put up a Mende, right? It's the party that's associated with your ethnicity. Before we go on, let me just say, again, there's this perception, politics is rife in low-income countries. It's all based on, ethnicity, and people will vote for whoever because of ethnicity. That's all they care about. That's also true in the US, right? Ethnicity is very high predictor of how you vote. So don't think of this as some other weird thing that people do in low-income countries. Like, we do it too. So just want to get that out there. But it can lead to bad lack of accountability in politics if people do vote based only on that, because you want them to vote based on, on performance, right? How good is this person? Do they agree with the kinds of things that I agree with? And you're not going to get accountability if people, people said in New York, they will vote, they'll elect a Democrat even if it's a dog, right? There's, i.e. saying there's not anything about, they're not judging whether this is a good politician. So it's a problem, but it's not a problem that's only in low-income countries. So we wanted to test this hypothesis further of, was it the case that people were voting on ethnic lines because they didn't have information about the candidates? So how do we test that? We give them information about the candidates, okay? So we worked with a local media organization in Sierra Leone who's very well known, and therefore people agreed to be interviewed by them. And they ran these debates. You can see the SLPP and the APC candidates, right, in these debates. Like, green is the SLPP color, and then there was a third party running in that particular election. So Search for Common Ground ran these debates, filmed them, and then took them on a roadshow to rural areas, because you can't put them on the TV because nobody has a TV. But you simulate media by bringing them TV for a night and showing them the debate in the local community center, or often projected against the school, the wall of the school. And it's often in Creole, which is, the debates are in Creole, but they also, this guy is translating it into the local language as it goes. Okay, and we looked at what that did to voting. And the first thing we see is that there was very, very little level of information in these communities. So one of the things you want voting to do is to hold politicians to account. In Sierra Leone, every politician, every MP candidate is given some money to spend in their constituency, called the Constituency Facilitation Fund. But if the community doesn't know how much money that is, how are you going to hold them to account for spending that? How many people knew how much money there was? 3.4%. So very, very low levels of information. After they've watched the debate, where we talked about the fund, how are you going to spend it? One of the questions was, how are you going to spend it? The question was, audience, by the way, every MP gets this amount of money to spend, and then they turned to the politician and said, how would you spend it if you were elected? Right? A lot more people in the treatment group know about this fund and know how much it is. They also know more about which candidate is better educated. I mean, we asked a ton of these questions. I'm not going to show them all, but they know a lot more about the character of these. What job did they do? Who's better educated? who's worked in the community before. What job did they do before they ran for Parliament? They also knew whether, this was the candidate who believed in education or health. Like, what was their first priority? And so in this election, the SLPP is running on an education platform, and the APC is running on a health platform, and they knew that, and they were much more likely to know that after watching these debates. But did it actually change how they voted in this country where your ethnicity overwhelmingly predicts how you're going to vote? Well, actually, it did. 5 percentage points more people voted for who was considered by experts to have won the debate. So more than that of people might have changed. We can't tell. We can only look at the net effect. Like, you might have had changes going both ways. This is the net effect. So at least 5% of the population changed how they voted. And we can do that both in surveys and by looking at actual data. But what is the impact of that on the politicians? The fact that they know that they might be grilled and they had to stand up in front of their voters for the first time anybody had done any of these debates between MP candidates. What's the impact on the politicians? Well, this is how they spent that constituency facilitation fund at the end, after they were elected. Because we not only randomized which villages we showed these debates in, we also randomized which constituencies we ran the whole experiment in. So we can compare the MPs from constituencies that we picked to run the program in and the MPs in the constituencies that didn't have debates. An awful lot of people spent none of the money in their constituency, right? Both in control and in treatment. But that goes down with treatment. So where debates were held, and they were videoed and simulated TV in these rural communities, you see that the MPs end up spending a lot more of their constituency facilitation fund in their constituencies. So overall, I think we know very clearly that mass media is a powerful influence on our behavior and our action. With so many different sources of media, it's quite hard to distinguish, to isolate the effect. But it is possible to design experiments to rigorously test, and non-experiments like the mountains in Indonesia, to test its impact. It's pretty hard to do that, but it is possible. And the experiments that I was looking at in West Africa, it's particularly possible to shift behaviors in an environment with very low levels of information and low levels of mass media to start with. But some of the effects may surprise you, like they did us, of just having access to radio. So just to tell you about some ongoing work, we're looking at, I'm currently trying to write up where we scaled up political debates to be pretty much over a lot of Sierra Leone, and see if politicians are willing to do the work to make them happen, and which politicians want to be part of debates. And then I'm also doing some work on combating misinformation, including through social media, which is now much more common in these low-income settings. In particular, one thing that's important to recognize is people will often have accounts on their phones to do social media that allow them access to the internet, but only for social media. So they can't Google, they can't get other forms of information through the internet. They have the cheapest accounts that you can get to get access to the internet on your phones restrict you to only getting information through social media.